He was one of the most ruthless and brutal Nazis of the Third Reich and the Second World War, and Reinhard Heydrich was known as the Butcher of Prague for good reason. He was the chief of the Reich Security Main Office and overseer of the Gestapo, Kripo and SD. But he was someone who some believe one day could have succeeded Adolf Hitler as the Führer, and he was one of the darkest men of the Nazi Party. Hitler even referred to him as the man with the iron heart. Heydrich was responsible for the slaughter of millions of people, as his Einsatzgruppen death squads rampaged across occupied lands, rounding people up and then shooting them in mass pits. Still today, many of Heydrich's victims remain lost to time and have yet to have been discovered in the pits where they lie 80 years later. Heydrich, when he was the protector of Bohemia and Moravia, instigated a reign of terror onto the Czechs, and he was targeted for assassination, with him being mortally wounded on the 27th of May 1942. He died days later, but his death has been something that has attracted immense amounts of speculation, as he was said to have been recovering well before he took a sharp decline and downward turn. Today we look at the autopsy of Reinhard Heydrich. To support, please make sure to subscribe. On the 27th of May 1942, British-trained Czech resistance agents Josef Gabčík and Jan Kubis were primed and ready to carry out the assassination of Reinhard Heydrich, the man who had caused much horror to the Czech people. There were people strung up from lampposts in an attempt to strike fear into their hearts and to keep the Czechs working hard in submission for the Nazi war effort. The assassination attempt was very well planned, and at 10:30 a.m. that day, Heydrich began his daily commute from his home to the SS headquarters at Prague Castle. He was driven by SS Oberscharführer Johannes Klein, and at a tram stop near to a junction in the road, Gabčík and Kubis waited. Heydrich's green open-top Mercedes car reached the curve in the road, and Gabčík pulled out his Sten machine gun, but the gun jammed. Heydrich, realising what was happening, then stood up and pulled out his Luger pistol. He told the driver to stop to deal with the two assassins rather than carry on, but then Kubis threw a modified anti-tank grenade towards the car, and when it exploded, Heydrich was severely wounded. He had sustained injuries to his left side, including serious damage to his lung, spleen and diaphragm, and he also fractured a rib. Heydrich tried to fight back on adrenaline, and was staggering towards one of the assassins, and he shot at one of them. But his driver then approached him as he collapsed against some railings and tried to hold himself up. His driver noticed that he was in severe pain, and he managed to stumble to the bonnet of his car, where he then collapsed. Heydrich was then taken to the emergency room inside the Bulovka hospital, and the doctor in charge packed his chest wound, and the chief of surgery, a Sudeten German man, tried his best to remove as many pieces of shrapnel from the high-ranking Nazi as possible. Surgeons also reinflated his collapsed left lung, and took off the top of the 11th rib, which was broken, and they also removed pieces of upholstery from the car, and his clothes that had penetrated his body. Following the surgical procedures 2 days later, Heydrich was being cared for by the SS doctors only, and they administered significant amounts of morphine to him. It's debated at the time whether he was given the experimental at-the-time drug of sulfanilamide, and allegedly SS Dr. Karl Gebhardt, Himmler's own physician, sent to treat Heydrich, decided not to administer it, as he believed Heydrich was recovering well and did not need it. But he then developed a fever, and his wound had to be drained, and he was in a lot of pain. On the 2nd of June, Heinrich Himmler visited him, but the following day he went into shock and then slipped into a coma. He was pronounced dead on the 4th of June 1942, around 4:30 in the morning. There have been many theories in the years following as to what actually killed Heydrich. Some have pointed fingers at Heinrich Himmler, as following his visit, Heydrich went downhill very rapidly. Was Himmler responsible for the killing of his friend, who he now deemed as too much of a threat? There has also been suggestion that horsehair from the upholstery of Heydrich's car was sent into his body when the blast from the grenade occurred, and that this may have caused an infection, and that this was missed by doctors. Another belief is that he suffered a massive pulmonary embolism. The strange circumstances surrounding Heydrich's recovery and then sudden downturn even led one scientist to hypothesize that the number 73 anti-tank grenade used in the attack had been modified to contain botulinum toxins. This would have meant that the plan all along was to wound Heydrich and to then infect him with the toxin, to make sure that if the initial blast did not kill him, than a nerve agent would. He was given the best care, but in the moments following Heydrich's death, his autopsy was performed, and this turned out some very interesting conclusions. It was outlined that death followed damage to the inner organs, heart, liver and kidneys, following poisoning, obviously through a highly virulent infection. Accumulation of fluid pus was established in the chest, the abdominal cavity and the organs. No pneumothorax can withstand such a thing. However, encrusted effusions were found to the rear surface and on the forward mediastinal surface of the left lung. The largest discharge of the rear surface was drained at its lowest point with a Petzer catheter. This meant that during the autopsy some form of infection was found, and there was evidence of this. It was then claimed that identification of the infection will be sought through bacteriological investigation. For the assumption of especially chemical poisoning from the explosive charge, there is not the slightest basis. Pathological anatomical diagnosis, bacterial general infection with opaque swelling of the liver, kidney and heart muscle, surgically treated gunshot channel through explosion, gunshot entry opening at the back level of the 11th rib. Now, it's not known whether SS doctors or scientists did carry out examinations on the type of infection to work out if Heydrich had been chemically poisoned by the bomb or not. It was also claimed in the autopsy that the shooting with the explosive charge, as in the British Mills grenade, suffered 7 days before death, has opened the chest cavity and subsequently penetrated the diaphragm and also the abdominal cavity, so that a rupture of the spleen took place. The surgical treatment of all these injuries had to take into account that these wounds were contaminated with simultaneously introduced germs, and therefore it was decided to conduct the expected inflammatory build-up of the edulation to the outside. Accordingly, after the removal of the spleen, the chest cavity and the abdominal cavity were completely satisfactory and were drained in the appropriate manner. The foreseen inflammation brought about by the introduced germs actually took place and spread outwards in the course of the days following the injuries into the area of the diaphragm wound. In the final period before death, there followed a spreading of the inflammation into the pericardium. That the bacteria or else the poisons must have also disseminated into the blood follows from the damage to organs essential to life such as the liver, kidney and heart muscle. In this part of the autopsy, the officials in charge concluded that the infection was caused initially from the explosion, which had opened the chest cavity and caused significant damage to Heydrich's internal organs. He was treated by the most prominent SS doctors, men who had even tended to Adolf Hitler and Heinrich Himmler's problems, but they seemed to miss the infection or chose not to administer antibiotics. The autopsy of Heydrich concludes in its final assessment that death took place as a result of the damage to the organs essential to life through bacteria or their poisons, which were introduced with the gunshot injury with explosive charge and which settled and multiplied particularly in the pleural cavity, in the diaphragm and in the region of the spleen. So the conclusion officially in the eyes of the Nazis and the SS was that Heydrich's death was caused by damage to the organs and the subsequent infection that came after the bomb had exploded. But one key man to consider in the whole affair is the rather shady character of SS Dr. Karl Gebhardt. Gebhardt was close friends with Heinrich Himmler, and his decision to not administer certain medications could have condemned the Butcher of Prague to his fate. He was, after all, directly looking after Heydrich. He was someone who, if Himmler had ordered him to, then he would probably have finished Heydrich off. Himmler did have a possible motive to kill Heydrich, as many inside of Hitler's inner circle were very fearful of Heydrich, especially as he was rapidly rising to power, and he was considered by some a possible candidate as a future Führer, encapsulating the brutal values of Nazism, even down to his Aryan appearance. Himmler may have feared Heydrich's access to Hitler too, and he may have believed that he would one day replace him as the head of the SS, which was very likely. Following the death of Heydrich, Himmler took over control of the Reich Security Main Office, succeeding Heydrich himself before he replaced him with the much lower status and someone with less power, Ernst Kaltenbrunner, in the role months later. Gebhardt was the one who had access to the patient, and he was someone who Minister of Armaments and Hitler's architect Albert Speer believed was actually trying to poison him when Speer himself became ill in 1944. The autopsy of Reinhard Heydrich is something that offers an insight as to what the doctors at the time believed killed Heydrich. It does show what killed him, but does not include information about if anyone could have stepped in to finish him off. Operation Anthropoid, the codename for Heydrich's assassination, was the only successful government-organised assassination of a high-ranking Nazi during the war, but was he finished off by someone much closer to him? Thanks for watching. To support our channel, please make sure to subscribe, and once again, thank you so much for watching.